The electrocardiogram, or ECG, is a fundamental tool in cardiology. It provides a visual representation of the heart's electrical activity. By placing electrodes on the chest, wrists, and ankles, we can capture the tiny electrical impulses that travel through the heart with each beat. These impulses are recorded as waves on a graph. The shape, size, and duration of these waves offer valuable insights into the heart's rhythm, structure, and overall health. Each heartbeat generates a distinct electrical pattern, allowing us to assess the heart's performance. Think of the ECG as a window into the heart's inner workings. It allows us to see the heart's electrical activity and identify any irregularities that may signal an underlying problem. From detecting arrhythmias to diagnosing heart attacks, the ECG is an indispensable tool in the diagnosis and management of heart conditions. The information gleaned from an ECG is incredibly valuable. It can help healthcare professionals make critical decisions about a patient's care. By understanding the basics of ECG interpretation, we can gain a deeper appreciation for the heart's complexity and the importance of this powerful diagnostic tool. The ECG tracing consists of a series of waves and complexes that represent different phases of the cardiac cycle. The most prominent features are the P wave, the QRS complex, and the T wave. These waves correspond to the electrical activity associated with the contraction and relaxation of the heart chambers. The P wave represents the depolarization of the atria, the heart's upper chambers. This is the electrical activation that causes the atria to contract, pushing blood into the ventricles. The QRS complex is the most recognizable part of the ECG. It represents the depolarization of the ventricles, the heart's lower chambers. The QRS complex is larger than the P wave because the ventricles are larger and more muscular than the atria. The T wave represents the repolarization of the ventricles, the electrical reset that allows them to refill with blood before the next heartbeat. By analyzing the duration and morphology of these waves and the intervals between them, cardiologists can identify irregularities in heart rhythm, conduction abnormalities, and signs of heart disease. For example, an abnormally wide QRS complex could indicate a blockage in the heart's electrical pathways. Understanding the basic components of the ECG waveform is paramount to comprehending the complexities of cardiac electrophysiology. It provides the foundation for interpreting ECGs and diagnosing a wide range of cardiovascular conditions. The heart's electrical system, known as the conduction system, is responsible for generating and coordinating the electrical impulses that regulate the heartbeat. This intricate network of specialized cells ensures that the heart beats in a coordinated and efficient manner, delivering oxygen-rich blood to the body's tissues. The electrical impulse originates in the sinoatrial SA node, located in the right atrium. The SA node acts as the heart's natural pacemaker, setting the rhythm for the entire heart. From the SA node, the impulse spreads through the atria, causing them to contract. The impulse then reaches the atrioventricular AV node, a relay station between the atria and the ventricles. The AV node delays the electrical signal briefly, allowing the ventricles to fill completely with blood before they contract. After passing through the AV node, the impulse travels down the bundle of His, a pathway that divides into the left and right bundle branches. These branches carry the electrical signal to the Purkinje fibers, which spread throughout the walls of the ventricles, causing them to contract and pump blood to the lungs and the rest of the body. This synchronized electrical activity, reflected in the ECG tracing, ensures that the heart functions as an efficient pump, delivering a continuous supply of blood to meet the body's demands. Disruptions to the conduction system can lead to arrhythmias, affecting the heart's ability to pump effectively.